The lymphatic nodes of the head and neck are called the ulnar ring. No, Wilder's rings. False. Where do you have reticular epithelium? False, doesn't exist. Where you have the cisterna cilia. Thoracic duct. How do you define lacteals? Digestive system / splanchnic area. What is the difference between chyle and chyme? Chyle, present in lymphatic fluid. Chyme, alimentary bolus. What is the hormone-producing lymphatic organ? Thymus, which produces thymosin. How many layers between fibrous pericardium and endocardium? 5. Endo, mu, epi, serous, and fibrous. The toll of the papillary muscle is to reinforce the contractile force of the atria. False. Atria doesn't have papillary muscle. List roles of the heart skeleton. Electrical isolator, attachment points for cardiac muscles, support for valves, passageway for electrical conduction of the heart. The mitral and tricuspid valves are semilunar. False. The septum is very vascular connective tissue. Yes, very vascular but not connective tissue. What is the destination of the fibers coming for the cardiac plexus into the heart? Sinoatrio and atrioventricular valve, control impulses at SA and regulate at AV. Example of one distributing arteries. Coronary artery, superior mesenteric artery. Why capillaries are exclusively exchange arteries? Only one layer of endothelial cells. What is the cause of varicose veins? Progressive venous distension, trauma, valvular incompetence. What is the mechanism of venostasis ulcers? Mechanical compression. Coagulation diathesis is a reason for DVT? True. What is the name of the condition arising from the metastasis of tumor to the upper segment of the right lung? Pankos syndrome. Hypertension divides into essential and idiopathic? False, it divides into essential and secondary. Essential and idiopathic are the same thing. What is complicated hypertension? Chronic hypertensive damage of blood vessels, chronic fibrosis of tunica intima and media, chronic hypertrophy of vascular smooth muscle, all these put together is called arteriosclerosis, which is complicated hypertension. What is the borderline hypertension? 140/90 mmHg. What is the diastolic pressure for malignant hypertension? 140 mmHg. What is the reason for orthostatic hypotension? Neurovascular dysautonomy. What is the name of an outpouching of cardiac chamber? Cardiac aneurysm. How many layers of the blood vessel are involved in a true aneurysm? All 3 layers. Can metastasis be embolic? Yes. What is abortans thromboangiitis obliterans? There is nothing like that, it is Buerger's disease. What is the etiology of Buerger's? Autoimmunity. What is the name of episodus vasospasm of arterioles? Raynaud's disease. What is the main reason for coronary artery disease? Atherosclerosis. Arteriosclerosis hardens the plaque. False. Calcium deposits and fibrosis hardens plaques, a process called atherosclerosis. Bradipsychia, psychosis, and hypothyroidism are risk factors for coronary artery disease. False. How does cigarette smoking works in favor of myocardial infarction? Nicotine can induce generalized vasospasm, increase in carbon monoxide in blood and widespread endothelial injury. Examples of myocardial hypoperfusion? Stable net unstable angina, silent angina, myocardial infarction, Prinzmetal angina, acute coronary syndrome. Which of these belong to possibilities of myocardial infarction? It heals by repair. A myocardial infarction shows structural and functional changes in the heart level? True. Can a myocardial infarction be subendocardial or transmural? False. Just transmural, no such thing as subendocardial. Can valves of the heart be subject to infarctions? False. Valves are vascular. Are valves subject to regurgitations, vegetations, and stenosis? True, they can. What kind of murmur do you get from mitral stenosis? Diastolic. What kind of murmur do you get from aortic insufficiency? Diastolic. What kind of murmur do you get from mitral insufficiency? Systolic. What kind of murmur do you get from tricuspid insufficiency? Systolic. What kind of heart will tend to develop heart failure? A heart with ventricular hypertrophy. What are some examples of dysrhythmias? Sinus tachycardia, sinus bradycardia, sinus fibrillation, asystole, premature ventricular contractions, atrial fibrillation, atrial flutter, ectopic beats. Can trauma to the spine produce shock? Yes, spinal shock. Why does a burn lead to shock? Third space fluid shift leading to hypovolemic shock. Where do you find intermittent claudication? Arterial disease of the lower limbs. Can trauma to the chest lead to an infarction? False. Trauma can cause pericardial tamponade. Dilated cardiomyopathy will lead to what kind of cardiac failure? Systolic heart failure. Concentric cardiomyopathy will lead to what kind of cardiac failure? Diastolic heart failure. Concentric cardiomyopathy occurs in ventricular hypertrophy. Hypertension is the origin of plaques? False. It is atheroma formation. Is hypertension the origin of diabetes? Yes, it will cause widespread endothelial damage. What is the meaning of the Q wave? Septal depolarization. A systolic murmur on aortic focus indicates what? Aortic stenosis. A diastolic murmur on pulmonary focus means what? Pulmonary insufficiency. The widening of the QRS complex indicate blockade of the His bundle? True. If you find loose chordae tendineae, what will it indicate? Papillary muscle infarction. What is the general reason for Prinzmental angina? Coronary vasospasm mostly. It could also result from an unstable plaque acting like a flap. What is the main problem of plaque presence? Turbulence of blood flow and degranulation of platelets to form clots. If you block the right coronary artery, what is the outcome? Transmural right-sided massive myocardial infarction. What is the reason of getting rheumatoid arthritis? Autoimmune, and it has no relationship with the heart. What is the reason for rheumatoid fever? Group of beta hemolytic streptococcal infection. What happens with irritative spots on the myocardium? Ectopic beats. What is a pericardial effusion? Presence of fluid in the pericardial space. What is the more feared complications of atrial fibrillation? Micromobilization. Give one outcome of hemopericardium. Cardiac tamponade. Portal hypertension may be a complication of heart failure. Yes, it can be. What is the etiology of venous stasis ulcers? Compressive damage of the basement membrane of the skin. Distended tortoise and palpable veins are understood as aneurysmal structures. No, those are varicose veins. What is the result of damage to the vasa vasorum? It caused damage to the wall of the blood vessels. Vasa vasorum are the small capillaries that feed the walls of the blood vessels. Hypertension triggers bradycardia? False. It should trigger tachycardia. Phlebothrombosis is a synonym of thrombophlebitis? False. The main risk of acute pericardial effusion is acute pericarditis? False. What is the most common cause of right-sided heart failure? Hypoxic pulmonary disease. Describe heart failure. Types of cardiac dysfunction that result in inadequate perfusion of tissues with blood-borne nutrients. What is infective endocarditis? Inflammation of the endocardium due to an infection, bacteria, fungi, viruses, parasites. What are the 4 factors of rheumatic fever? Carditis, polyarthritis, chorea, erythema marginatum. What bacteria causes rheumatic fever? Group of beta hemolytic streptococci. What are the risk factors for coronary artery disease? Dyslipidemia, hypertension, cigarettes, diabetes mellitus, obesity/lifestyle. What is gravitotoxemia? Eclampsia. What does HELLP mean? Hemolysis, elevated liver enzymes, low platelets. What is the first line of defense against infections? Surface barriers that prevent the entry of pathogenic substances such as the skin and mucous membranes. How does the skin defend against infections? Contains biochemical defense agents such as sebaceous glands which secrete chemicals which inhibit the growth of some bacteria. It also releases acidic secretions to lower pH and prevent bacteria from growing. How do the mucous membranes defend against infections? A thin region containing living surface cells that release fluids to wash away pathogens, contains biochemical defensive agents, Secretions contain lysosome which can destroy cell walls and cause cell lysis, may contain cilia which aid in the removal of pathogens. What is the second line of defense against infections? Non-specific defensive mechanisms which include phagocytic leukocytes, inflammation, fever, and antimicrobial proteins. What is the third line of defense against infections? Specific defensive mechanisms which include lymphocytes which recognize and respond specifically to different types of microorganisms and have memory of them. What is an antigen? A substance that the body recognizes as foreign and that can evoke an immune response. What is an antibody? A protein produced by certain white blood cells in response to an antigen. What is the effect of HIV on the immune system? A retrovirus that infects helper T lymphocytes, reverse transcriptase allows viral DNA to be produced from its RNA code, which is integrated into the host cell's genome. After a number of years the virus becomes active and begins to spread, destroying T cells in the process. Examples of bacterial infections? Neisseria meningitidis, Salmonella, some strains of E. coli, Pseudomonas aeruginosa. Do bacterial infections and humans co-evolve? Yes, humans, and many harmless bacteria have co-evolved. Some are more sinister than others though. What is the relationship between fungal infections and humans? Are a more recent threat to human health, and a distinct danger to patients with a compromised immune system. What are some facts on parasitic infections? No vaccines to control or prevent spread of disease, leading cause of death and disease in tropical and subtropical areas. What are some facts on viral infections? Can only replicate inside the host cells. Many have evolved to evade the defenses of the immune system, can also cause several forms of cancer. Example, human papillomavirus can lead to cervical cancer. What is host-mediated pathogenesis? In certain infections, the tissue damage results from the toxic mediators released by lymph node cells rather than bacterial toxins. What is intracellular growth? Some bacteria can grow only within eukaryotic cells, whereas others invade cells but do not require them for growth. Most pathogenic bacteria multiply in tissue fluids, not in host cells. What do virulence factors do? Help bacteria to invade the host, cause disease, and evade host defenses. Types of virulence factors. Adherence factors, capsules, endotoxins, exotoxins, siderophores. What are adherence factors? Many pathogenic bacteria colonize mucosal sites by using pili to adhere to cells. What are capsules? Many bacteria are surrounded by capsules that protect them from opsonization and phagocytosis. What are endotoxins? The lipid polysaccharide endotoxins on gram-negative bacteria cause fever, changes in blood pressure, inflammation, lethal shock and many other toxic events. What are exotoxins? Include several types of protein toxins and enzymes produced and or secreted from pathogenic bacteria. Major categories include cytotoxins, neurotoxins, and enterotoxins. What are siderophores? Are iron-binding factors that allow some bacteria to compete with the host for iron. What is bacterial vaginosis? A group of diseases of the vagina caused by an imbalance of naturally occurring bacterial flora, and is often caused by yeast infections. What is bacterial meningitis? Is a bacterial inflammation of the meninges, which are the protective membrane covering the brain and spinal cord. What is bacterial pneumonia? Is a bacterial infection of the lungs. What is a urinary tract infections? Almost exclusively caused by bacteria. The main causal agent is Escherichia coli. Urine contains a variety of fluids, salts, and waste products. It does not usually have bacteria in it, but when bacteria does, it causes an infection. What are the symptoms of a urinary tract infection? Frequent feeling/need to urinate, pain during urination, cloudy urine. What is bacterial gastroenteritis? Caused by pathogenic enteric bacteria. What are examples of bacterial skin infections? Impetigo, erysipelas, cellulitis. What is impetigo? A highly contagious bacterial infection, common in preschool children. Primarily caused by Staphylococcus aureus and sometimes Streptococcus pyogenes. What is erysipelas? Acute Streptococcus bacterial infection of the deep epidermis with lymphatic spread. What is cellulitis? A diffuse inflammation of connective tissue with severe inflammation of dermal and subcutaneous layers of skin. Skin on the face and lower legs is most common. What are the causes of cellulitis? Caused by normal skin flora or by exogenous bacteria, often occurs where the skin has previously been broken, cracks, cuts, blisters, burns, insect bites, surgical wounds, etc. Which vaccinations should a child have received by the ages of 2? Hepatitis A and B, polio, MMR, DPT and tetanus, Hib, chickenpox, rotavirus, influenza, meningococcal disease, pneumonia. Which 2 fungi are humans most likely to get? Dermatomycosis, dermatophytosis. What is dermatomycosis? A fungal infection of the skin. What is dermatophytosis? A fungal infection of the hair, skin or nails. What do parasites produce? Infestations. What are some examples of protozoa? Any of a large group of one-celled organisms that live in water or as parasites. Many protozoans move about by means of appendages known as cilia or flagella. What are some examples of endoparasites? Plasmodium, Entamoeba histolytica, Giardia lamblia, Trypanosoma brucei, Trypanosoma cruzi, Toxoplasma gondii. What does hemotic mean? Containing or related to blood. What does Plasmodium ssp cause? Malaria, usually transmitting of mosquitoes. What does Entamoeba histolytica cause? Amoebiasis. What does Giardia lamblia cause? Giardiasis, the parasitic places in the duodenum. What does Trypanosoma brucei cause? African sleeping sickness, transmitted by the tsetse fly. What does Trypanosoma cruzi cause? Chagas disease, transmitted by the pedo bug. What does Toxoplasma gondii cause? Toxoplasmosis, cats play an important role in the disease's spreading. What is Ascaris lumbricoides? Causes, intestinal ascariasis caused by a type of roundworm. What is Enterobius vermicularis or oxidors? Causes enterobiasis. What is Trichuris trichura? Live in the lumen of jejunum. Thin proboscide on the cephalic end, to feed and attach on intestinal wall. What is Trichinella spiralis? Larva causes severe muscle invasion, sensitivity reactions, eventual death, happens due to poorly cooked pork. What is Schistosoma mansoni? Causes schistosomiasis, transmitted from snails in ponds. What does Strongyloides stercorellus cause? Causes life-threatening strongyloidosis if immune system drops, no vector. What does Dracunculus medinensis cause? Also known as dracunculiasis, ingestion of water contaminated with Vetercopepod. 3 feet long female migrate to legs. What does filaria cause? causes elephantiasis, Victor, Anopheles mosquito. What does hookworm cause? Severe anemia. What does Toxocara canis cause? Ocular, pulmonary, hepatic, muscular, and cerebral lesions. Dogs and cats that are infected can shed Toxocara eggs in their feces. What are the different types of tapeworms? Taenia solium, saginata, Diphyllobotrium latum, Echinococcus. What do tapeworms cause? Abdominal symptoms and severe B12 deficiency. What does the tapeworm cause? Leads to severe, life-threatening brain cysts. What does Sarcoptes scabiei cause? Scabies, as the mites burrow and lay eggs inside the skin, the infestation leads to relentless itching and an angry rash. What is Pedicula scabatus? Headless. What is Demodex follicularum? Eyelashes mite. What are Phthyris pubis? Pubic lice. What do ticks cause? Borrelia burgdorferi, which is Lyme disease.